Okay, we're recording. So yeah, Mariana, so those study guides are built from lecture recordings, readings, and your weekly notes. So make sure you take good notes in class, and you should be able to build your study guide based on all those three resources. Okay? Does anybody else have any questions before I go into our housekeeping items? Okay, I need to be able to see everybody's face on camera. Kimberly, I'm looking at your forehead. IKEA, if you can move the camera up a little bit, I'm looking at your forehead. And Danya, if you could come in a little bit closer for your camera. I'm only seeing your forehead. Okay, just waiting for one more student. Who am I waiting for? Justice. Anybody know if Justice from Port St. Lucie is coming to class today? Okay. So welcome to week 8, holiday week. I hope everybody can find some time towards the end of the week to check out and spend some time with family and enjoy the holiday. I'm going to try and do that at the end of the week. But I do want to wish everybody a happy Thanksgiving before we get going here. Couple of housekeeping items. We just talked about the exam 3 study guide. Today we're going to go through some housekeeping items. Then we're going to take quiz 5. And then we're going to cover the content. We're going to review the content for weeks 7 last week, since you were taking an exam, and week 8. Okay. Exam 2 grades were posted Friday evening. And so I'm open to meet with anybody who would like to review the concepts that they missed for the exam. So you guys let me know if you want to review the concepts missed. Just send me an email with some days and times that will work for you. And then we'll schedule something. Okay. Group projects I graded this morning. Really, really excellent job. Excellent job. You covered the rubric. Most groups covered the rubric fully and got full credit for the project. So you really did a nice job. Thank you for your hard work on that. If we have time today, I didn't have time yesterday because we covered 2 weeks of content. We'll do some presentations at the end of the class of your group projects to everybody. If we have time. If not, we might have to bump that to next week. But I ran out of time yesterday, but we'll see what happens. This week, we just have a quiz. That's it. That's all that's due this week. Next week gets real busy, week 9. Okay, so for week 9, you have your HESI prep that's due. You have an NCLEX due. You have your second case study. Your HESI case study is due. And then remember, next week, week 9, are the reviews for exam 3. Okay. So there's 3 live reviews. You have a master calendar of that, which you were provided early in the term. So please go back and look at that. And hopefully maybe plan on trying to attend a review. And again, you'll get all 3 recordings as well. Okay, so next week, busy week. Okay, and then next week is actually the last week of content presentation because week 10 is your exam and week 11 is your HESI. Okay, so, and then remember in week 10, exam week, your vulnerable populations assignment is also due. Okay, so you get a busy couple of weeks. This week is pretty light with just the quiz. for this class. So I don't have any of the assignments locked. So if you want to work ahead a little bit, you're more than welcome to. All right. I'm starting to get some campuses that have I have a master calendar of when HESIs are scheduled for campuses. I'm not going to post that yet. I'm still missing a couple of campuses, but let me see if I have Essington for Essington students. It looks like the HESI. Have you gotten the emails yet from the campus to schedule yourselves? Anybody got from Essington? Has any you got? Okay, you
No,
haven't. And pardon me.
no, we didn't.
Okay, and then Port St. Lucie. So I do have those two. Now these are dates that are in the master calendar. You should be receiving probably the next couple of weeks an invitation to sign up for them. I'm only providing you dates to give you a heads up. It looks like Essington Community HESI is going to be on Monday, the week of the 11th, are all the HESIs. So it looks like Essington is scheduled for Monday, the 11th at 9. Okay, but you're going to have to wait for the invitation to sign up from your campus. I'm just trying to give you a heads up. And then Port St. Lucie students, it looks like you are listed as taking the HESI on Tuesday, the 12th at 1 p.m. All right, so I don't know if your other classes have given you that information yet, but that's what it is. That's what it shows for community. So Monday and Tuesday for this group. Okay. Any questions about that? Okay. Okay, before we start our quiz, does anybody have any questions in general? I think this is the weekend going into week 9 where I send out my announcement that's a roadmap for the rest of the term. It goes through, just kind of goes through what I was just talking about, weeks 9, 10, 11, and 12. So you'll be getting that this upcoming weekend. Okay. Anybody have any questions? Rashima, are you there? There you are. Okay, Rashima, if you could pull your camera down so I could see your face. Thanks. Okay, great. All right, so quiz 5 is open for you to take. I need you to stay on camera. Let's see, it's 108 or 109. So let's take 15 minutes until 125. Take your quiz. Make sure you submit when you're done, and then we'll review the quiz when we're done. When you're done, please keep your camera on. Okay. If you need to go take a break or get a drink, that's fine. But we'll resume at 125. Okay.
I'm gonna, yes,
Pardon me?
excuse me, I'm gonna switch over from my phone to my
Okay.
laptop after I take the quiz.
Okay. That'd be great.
Okay.
Okay. So go ahead and start the quiz. I think everybody's muted. And I don't need to know when you're done. I can see when you've submitted in the grade book. So take your time. You got 15 minutes. Hey, Shanti, I sent you a message in the chat. You check that? I need you to submit. And Rashima, I sent you a message in the chat. Hey, it looks like everybody's done. So if everybody could put their faces in the camera, I would appreciate it. Rashima, I don't know if you heard me, but I sent you a message in the chat. Okay, thanks. And Rashima, if you could move your camera so I can see your face, that'd be great. Majesty, you around? There's Marianne, Mariana, Jakesia. Okay, there you are. Shima, I still can't see you. Now I can.
Hello, how are you? Could you see
There,
me?
there you are.
All
I sent you a message in
right,
the.
I'm a little bit busy today.
Oh,
All
okay.
right.
No worries. Okay, let's go ahead and review. Pardon me. Let's review the quiz.
Kids are home from school this week, so
Oh, yeah, yeah,
yeah.
yeah. Oh, I remember those days. Yep. We used to only have, sometimes I don't even remember having Wednesdays off, but I remember we used to be off on Fridays. But now it seems like a lot of kids have the whole week off from school.
Yeah, I think they get off too many days nowadays.
Yeah. Oh, I don't miss those days. Oh my gosh. Okay. School nurse notes several children developing a pustular rash on their faces and extremities following several days of fever and malaise. Which step would the nurse take? So before we go to answer, what would you pull out of that question that you would highlight as significant information to answer the question? What's important in that question?
I was thinking of the fever for several days.
Okay, good.
The rash on their face.
Yep. Okay. And based on the concept that we covered, that's covered on week 7, which is bioterrorism and disaster, what would be the correct answer?
Notify the authorities of potential smallpox in the school.
Yep. And why is that the correct answer? Are those symptoms of a potential smallpox case?
Because there's a breakout, obviously, and several of them have it.
Right. And the fever?
Fever and the malaise.
Yep. Yep. We certainly, pardon me, we certainly wouldn't be doing D, right? Evaluating the scalp for excoriation marks and lice, because those are not symptoms of lice, right? Having a fever for 8 days, we wouldn't recommend a follow-up when they're feeling better, right? 8 days is a long time to have a fever. We need to get in and seen, right? And assess the vaccine records for varicella vaccine. That's wrong because this doesn't have anything to do with varicella, correct? Okay. Number 2, nurses caring for an immigrant who is pregnant with their first child. There are no vaccination records available. Which vaccine should be prioritized? It's the correct answer.
Rubella.
And why is that the correct answer?
For a couple of reasons. First of all, it's the immigrant their first child and they had no vaccination records at all, and the vaccine helps protects against certain other diseases
Okay, so
like
why
the
do we?
measles,
Mhm.
mumps,
Okay, so why is
rubella.
rubella prioritized?
Oh,
Isn't it like to protect the baby?
Mhm. I mean, you all
Well,
got this question right, so you should have an idea of why rubella is prioritized.
Because
I
the
just
live
thought
vaccine,
Go ahead.
because the live vaccine,
Yep,
that's
exactly. Exactly. So did everybody know that? That's the primary reason. Okay. The health department nurse is caring for a 16-year-old female with a new diagnosis of gonorrhea. Which education should the nurse provide? Okay, so what is important to pull out of this question? And let me review something real quick that I reviewed with my class yesterday. If you came to my review or you watched my recording for exam 2 review, I went through a PowerPoint of how to break down questions. And there were 4 areas that when you're attacking questions on exams or quizzes that are important. One is it a positive or negative frame question? We all know what that means at this point, right? Give me an example of a negatively framed question. I know I'm getting off course here, but I'm doing a little bit of test prep here. What's the difference between, give me an example of a negatively phrased question.
What would a nurse not do for a patient? Maybe something like that. Like,
Okay,
what would they not do if they had a C-spine injury? What would they not do to hurt them? Like, what would they, like the precautions they would have
Mhm.
to do?
Good. Another one could be when teaching a family, doing discharge teaching with a family of somebody who's had a stroke.
If the patient doesn't know they're
Right.
teaching.
What does a patient say back to you in the teaching that's incorrect? That you know requires more teaching or clarification. All right, so that's first and foremost. Is it a positive or negative question? Second key is, what are the key words in that question? Is there a key word, a phrase,
New
a cue?
diagnosis.
A cue? Yep, yep. So like in this question, I don't think anything matters except somebody has gonorrhea, right? Doesn't matter the age of the female, doesn't matter if it's a new or old diagnosis or repeat diagnosis, right? So that's the third tip on breaking down a question is how can you rephrase the question to be simpler? So this question is how can you rephrase this question to be simple? What do you teach the client? What do you teach the client to report if they have gonorrhea?
If they have bad symptoms, that could get
Right.
bad or worse. So you're gonna teach her if the symptoms if they get worse or they get better, call the doctor or
Exactly.
go back to the hospital.
So the rephrasing of this question is pretty simple. A client has gonorrhea, make sure they know to report any pelvic or abdominal pain associated with a fever, right? The 16-year-old new diagnosis, none of that matters in the question. So that's the rephrasing. Can you rephrase a question to be simpler? Okay. And then the last tip is crossing answers out that you know are not correct. Doing that right at the beginning. All right. So that's why I suggested in my review to try and use those 2 resources in ExamSoft, the highlighter and the line through the incorrect answers. And if you don't use those, I would encourage you to try. All right, so we know that the correct answer is B for this question. Why is A wrong?
Because you want to
That's
finish
difficult.
antibiotics when
Exactly.
until they're out now, until the symptoms are gone. Hey,
Exactly. Exactly. Why is C wrong?
because you don't want to have sex with period, let alone using condoms. You should avoid sex all around.
Okay. Why is D wrong? Can somebody answer other than Kristen? Although I appreciate Kristen's input, can somebody else answer? Because everybody got this question right. Why is D wrong?
Because we don't need to know her history. We just need to know that this is what she has now and she has to deal with it.
Correct. And if she chooses to inform previous sex partners, that's up to her.
Mm-hmm.
But that's a breach of confidentiality, right?
I have a question. Is that the same for HIV though? Aren't they obligated to report that?
Yes, but we're not talking about HIV. Yeah, but
Okay.
yes. Okay, question 4. The occupational health nurse is caring for a client who just sustained a needle stick injury at work. Which education should the nurse provide regarding HIV testing? So before we go to the answers, somebody rephrase that question with only the information we need.
Needle stick injury.
Okay,
What education?
it kind of doesn't matter though, right? All we're asking is
HIV test.
HIV testing. What are the
HIV.
guidelines for HIV testing? That whole first sentence, we don't really need, right? So what's the correct answer?
Return for another HIV test in 3 months to determine exposure.
Okay, why is that correct? Why is that the correct answer?
Because it might not show up right then and there, but it'll show up later on.
Show up within 12, it may show up, you may have a negative test that you
Now,
could now,
which is like a false negative.
right? But the antibody could show up for as long as 12 weeks.
Mhm.
Why is A wrong?
Because what we just said.
Exactly.
And then waiting for the HIV testing for the next year is too long.
Yeah.
Right. Right? And then same with D. Okay. It can appear up to 12 weeks. Question 5. The nurse is developing a primary prevention program for tuberculosis. Which intervention is appropriate? So we're looking for a primary prevention, which is what? What's primary?
The first step to prevent.
Prevention.
Prevention.
First step in prevention.
Okay. So if it's primary, what are we looking at? What's the correct answer?
You're gonna do a teaching,
Reduce the crowd.
get them to prevent tuberculosis.
No, if you still, everybody got this question right. So what's the correct answer?
Reduce crowded living
Reduce crowded
conditions
living
in
conditions in
communities.
community homeless shelter.
Why is that primary?
Because you're doing it to prevent getting the disease, the condition.
Living in such close quarters with people,
Exactly.
you'll get things amongst each other.
Right. So if we're talking prevention, we
Mm.
know that crowded living conditions and community homeless shelters present a higher risk
For TB.
for TB. Right. So if we go straight to the beginning and try and reduce crowded living conditions, we could hopefully reduce the risk of a TB outbreak. What is A? Primary, secondary, or tertiary?
Secondary,
Why, Mariana?
because we're teaching.
Okay. Well, teaching is at
Never
all
mind,
three
sorry. I
levels.
read it
Go
wrong.
ahead. No, secondary is right. Just why is it secondary? What is secondary?
Because it's secondary is usually screening or the teaching.
And
To
another way to describe secondary is early identification, early intervention. So we have identified the environment, homeless shelter, as a higher risk environment, right? So we are screening or teaching them signs and symptoms of TB because of the environment, right? So it's that early identification, homeless shelter, early intervention, doing some teaching about signs and symptoms. What is B?
Um, I think it's tertiary.
Because
They have it and they just trying to find ways to minimize it. They already have it, and they taking the medication, so they trying to find
Exactly.
ways to, you know,
exactly. All right. So they're already taking antibiotics. So they have it or have something, right? And then what is D?
Primary.
Okay. Try again.
secondary because we're testing the skin.
We're screening,
Screening, yeah.
right? Everybody understand that? Okay, question 6. The home health nurse is visiting a client recovering from right hip replacement performed 8 days ago. Client is complaining of calf pain in the left leg. Which nursing intervention is a priority? What cues would you pull out of that question? What's important to know from that question?
Priority, nursing intervention is priority. Which
Priority is a word, that's key. What else is key in this question?
Right hip replacement performed
The
8 days
leg.
ago.
8 days ago. That's a while. Okay, so what jumps out before you even look at the answers? Going back to your med surge, what jumps out as possible complications?
The edema and arrhythmia.
Right, but what do you think?
the pain in the left leg.
Pain in the left leg from a surgery performed 8 days ago.
Mhm.
What red flags does that raise of potential
Like
Blood
what?
clot.
blood clot? Correct. So so that's the other tip I always have, even though it wasn't in that PowerPoint, is when you read a question, try and not look at the answers and come up with your own answer. Right? So after you read that question, you would have thought, maybe we're talking about a blood clot here. So now you go look at the answers of what you're going to do to assess for a potential blood clot. So what's the right answer?
let's care for a
Hey.
edema.
And why is that the correct answer?
Because
Yeah,
that's that's where a blood clot will form.
Well,
More
those are
prone-
those are some symptoms of a potential developing blood clot, right? Edema, erythema, right? Why is B wrong?
Talking about a right hip.
Okay.
Drainage. Drainage, it sounds more like an infection in that one.
Well, evaluating drainage from the right hip wound, it doesn't say anything about that in the question, does it?
Mm-mm.
The issue in the question is calf pain. Doesn't say anything about the wound. What about discussing why is C wrong?
Not trying to manage the pain.
And you don't even know what the problem is yet, so you can't, really give no pain meds, and you don't know what the actual problem is.
Absolutely, that's exactly right. Right, so they're complaining of calf pain. They've had surgery. We can't jump to the conclusion that that is a pain medication issue. We need to be thinking blood clot. And then D is incorrect because it's incorrect. Right, so if you've read this question, you could cross out B, C, and D, could you not? And you're left with one answer. I have a lot of students who say they benefit very much by crossing out incorrect answers on their first time through reading the question. Because then you're not reading it again. Those answers again, they're already gone. Rashima, are you still there? I'm just looking at your ceiling. Okay, number 8 or number 7. So remember
Can I
that.
go to the bathroom really quick, please?
Sure.
Thank you.
Sure. So these next several questions are really med-surg focused questions. They're in our week 8 concepts of caring for complex chronic illnesses. Okay, so now we have a client with peripheral artery disease in both legs. Which client education should be included? What's the correct answer?
Stop
Stop
smoking.
smoking.
Okay. Why is that the correct answer?
Because he has a chronic peripheral arterial disease. So, and it has him in both of his legs. So by smoking, he's giving himself the chance to have blood clots go down his legs because he doesn't have enough air, going through his oxygen
flow.
going through his body. He has more carbon monoxide than oxygen.
Excellent. Excellent, Charisse. Good. Why is B wrong?
Compression stuff. D, you said?
B. Why would B be wrong?
Because you can't use compression stockings when there might be a blood clot.
Okay, and there's no mention in the question about having edema.
Mm-mm.
Position a pillow under the knees while in bed. Again, no indication that that needs to happen. Okay, question 8 is a COPD question. Which dietary modifications should be used by a client with COPD? What's the correct answer? Think med-surg, think about COPD. What are we teaching clients with COPD at home?
Didn't we have a question like this on the test where we had to put the patient in the other room for them to eat or something like that so they could concentrate on eat?
They were choking, remember?
Yeah, they were choking.
They were coughing and choking. So what's the right answer here for
So
COPD?
rest before starting a meal.
Yeah, why?
I did process of elimination, to be honest with you.
No, that's perfect. Okay,
3
so
large meals would be, I wouldn't be recommended because it's just a large meal.
well, and they're already compromised, right? That's a lot of work to eat a large meal,
We wouldn't remove their oxygen.
correct? So you
And
did it by
then
okay, why is B wrong? Limiting non-caffeinated fluids.
I wouldn't recommend caffeinated fluids at all. So I just didn't, I don't know, it didn't sound right for me, that one either.
Can somebody else jump in and answer why B is incorrect?
Because
do
if
you,
you limited non-caffeinated fluids, that means you still gonna be drinking a lot of caffeine, the opposite.
Okay, great. Home health nurse is caring for a client with cirrhosis who lives alone. Which intervention is a priority? What can you pull out of that question that you really need as hints or cues?
Lives alone.
Lives alone,
Cirrhosis,
cirrhosis,
priority,
and priority.
intervention.
So think about what you know about cirrhosis. What are clients with cirrhosis at risk for?
Falls.
Falls. So what's your priority assessment?
Evaluate gait and environmental risk for falls.
This is this is a good example of a question that B could potentially be correct, right? C could potentially be correct. D could be correct. But it's not a select all that apply. So if you get into this situation and go, all these look okay, what should you do?
What's priority?
Go back and look at the question and see what you missed. You missed which is the priority. Make sense? Okay, which food should be avoided by a client with poorly controlled hypertension? What do we know about hypertension?
Sodium, you can't, I was canned soup because of the heart and it's too much sodium.
Too much sodium. Everybody got that right? Okay, what questions did you have on the quiz? Okay, let's go through some content from last week and this week. Okay, so last week, what was covered was infectious disease prevention and control, HIV, TB, STDs, and bioterrorism and disaster. Okay, so we know that our environment, we're talking about infectious disease in the community. Okay, we all know, we all work in facilities that have infection control protocols, guidelines, but we also have to take seriously infection control prevention, infectious disease control and prevention in the community. Okay, I work with this in the schools. Okay, pertussis outbreaks, influenza outbreaks. Okay, we had a pandemic. Okay, infection control, control and prevention is really important in the community setting. We know that our environment is affected by many different things: physical issues, biological issues, social issues, cultural factors. Okay, so one of the things we talk about in infectious disease control is it's called the epidemiological triangle, right? Can anybody tell me what makes up the epidemiological triangle without looking at your notes?
The host.
The host. What's before the host?
Everything, the surroundings, I mean, because it's
That's your
environmental.
environment, okay? But what do we need to affect the host and see what the effects of the environment are? What do we need?
The agent,
We need an agent. Okay, so we need an agent, a host, and then the environment. Okay, so the agent is, what is it? What is it? Is it a bacteria? Is it a virus? Is it a fungus? Is it a chemical? Right? So we need something. So let's take the pandemic, for example. The agent was COVID. Okay, the host. The host is us. Who's being infected? Okay, and what affects us that could affect how we respond to the agent, the COVID? Are we healthy? Are we young and healthy? Are we older and more compromised? Do we have good nutrition? Do we have good exercise habits? Do we have comorbidities or not? Do we practice good hygiene? Take the flu, for example, or COVID. Okay, the host matters, right? When we had COVID, it was much more prevalent for older people to get sick, right? And even more prevalent for older people that were in homes to get sick. It was much less prevalent for healthy kids to get sick. Does that make sense? So the host has to be evaluated on health, comorbidities, maybe age, maybe some agents affect ethnicity different. Right, look at sickle cell. Okay, affects the African American community. So you have to look at what the agent is and then what the host is. And then the environment is whatever environment is in your surroundings. So for COVID, the schools, your environment was a school, much less likely to have very ill kids in the school versus a nursing home. That's your environment. We're much more likely for the spread of COVID. Does that make sense? So all these three are make up the triangle, and all these three are interwoven. You can have many different scenarios that come out of an agent, a host, and an environment. Does that make sense? So with regards to outbreaks, what's an incubation period? It's the time interval between invasion by whatever the agent is and the first appearance of signs and symptoms. To simplify, let's take chickenpox. You could be exposed to it, but not have symptoms for up to what, 21 days? Right?
It's the same thing for COVID too, right?
Same thing for COVID, right? And the communicable period is the time between when it may be transferred from an infected person until the time somebody else gets it. Think about the flu. Right? You may be living with somebody who has influenza but you may not get sick for a week. You know that old saying that just gets passed around the house? Not everybody typically gets sick at the same time, or maybe they do, but others may linger, and same with COVID. Okay, the difference between endemic and epidemic. So epidemic, that means that whatever's happening is happening at excess or expected levels. Right, that's an epidemic. All right, so that was COVID. We talked about COVID with that. COVID cases after COVID cases, just a huge spike in COVID cases. And it became an epidemic. But or let's take the flu. During the winter, flu rates are usually at epidemic levels, right? During the winter, our flu cases explode. But flu is also endemic. Endemic means it's not going away. It's going to stick around. Right? So we have months where we don't have epidemic levels of flu, or that we do have epidemic levels of flu, but flu is always going to be around, which makes it an endemic condition. Does that make sense? Did I explain that? Okay. So like an epidemic can also be called an outbreak. Right? We have an outbreak in my elementary school, we have an outbreak of pertussis. Okay? Let's say we have 6 kids in one class that have diagnosed pertussis. That's an epidemic. Okay?
Oh, shit.
The other thing, somebody need to mute. The other thing to know with regards to infectious disease prevention is there's requirements of reporting. Okay, the CDC on a national level has a list of diseases, conditions that are mandated to be reported. Okay. The list, though, of reportable diseases can vary by state. The CDC gives us overarching guidelines. Then the state can choose to modify those. Okay. So, for example, when I was in the schools, we had an infectious disease manual that was given to us by the state health department. It outlined every disease, every condition or disease that had to be reported to your local health department. And it also had a list of conditions, diseases that didn't. So, for example, pertussis had to be reported, where hand, foot, and mouth did not. And they're both infectious communicable diseases. Okay? COVID had to be reported, but chickenpox did not. Okay, so it's important to know that, and that's not just me as a school nurse reporting. Hospitals have to report. We're all held to the same guidelines. Hospitals report, doctors' offices report, urgent care centers report. Okay, so if I had a kid go to the emergency room or urgent care and was diagnosed with pertussis, okay, and then the doctor got the information, and then the parent called the school, all 3 of us have to report, right? I can't rely on the parent telling me we went to the ER last night. I don't know what they did. I don't have any paperwork yet. So we all have to report, all right? With regards to outbreaks, there's a difference between surveillance and observation. Observation is really the nursing process, right? Where we're observing for any kind of outbreak. right? We're collecting data. Let's say there was a food poisoning at a restaurant. Okay. And believe it or not, in public health, surveillance is a really important part of the public health nurse's role. So let's say in an outbreak, or let's say you had a bunch of college kids who all went to the ER and they ended up eating at the same restaurant. So you're now the public health nurse that has to do the investigation. Okay, so think of AdPie. You're collecting information, you're analyzing it, you're trying to interpret it, coming up with a plan, communicating whatever plan to the appropriate people who need to know, and then evaluating it. So for example, the college kids, what do you tell the college kids? Until this GI food poisoning goes away, don't attend class. Right? Come back to the ER if certain symptoms get worse. Okay? So you're assessing the situation. You're also looking for any kind of disease patterns. So for example, let's say with these college kids that went to the ER, well, the public health department will be contacting other ERs in the area as well. Let us know if you have any of these kids who ate at this restaurant. Okay, so you're looking at you're trying to identify trends. Okay? Because the whole purpose of this is trying to put together a rapid response. How do we slow down the effects of this food poisoning on the college campus at the restaurant? Right? What's our rapid response out to the community so we can stop it? Otherwise, it just keeps going and going and going. Look at COVID. Right? Just kept going and going and going. So that's observation. Surveillance, the goal of surveillance is to try and reduce morbidity and mortality. Right? You're trying to prevent the control of the spread. Okay? It does not focus, surveillance does not focus on eliminating community-based infections. That's in your observation phase. Okay? There's a lot of ways that infectious communicable diseases spread. Okay, we call these patterns of occurrence. How did it happen? What kind of outbreak was it? I've highlighted a few words here. Your point source outbreak. Okay, that's where everybody gets sick at the same time from the same agent. So maybe releasing a poisonous gas on a train, right? Everybody's exposed to the source. At the same time, everybody gets ill. It's a very pointed source. Okay, the next one is intermittent, right? Intermittent is an exposure over time. Okay, people may get sick at different times. Good example of this is food poisoning. Let's say everybody eats at the same restaurant tonight and the lettuce is bad. Some may get sick tonight, some may get sick tomorrow, some may get sick the next day. That's an intermittent outbreak. Okay, the mixed outbreak, okay, is person to person. One person is exposed to the source, and then it's spread person to person. Good example of this is the flu. So somebody brings the flu home. One of your kids bring the flu home from school. Right? Everybody's exposed, but you may get sick at different times or not get sick. Okay, and then there's one other outbreak pattern, and that is called propagated. Okay, where there's not typically a common source, It's spread over time gradually from person to person. A good example of this is TB. Okay. So when we're doing our surveillance or our epidemiology research, the first thing we have to do is conduct a needs assessment. Okay, developing community programs with regards to infectious disease outbreaks. We have to do a needs assessment. And there's 4 different stages of the needs assessment. Okay, and I've highlighted them right here. You have your pre-active stage, your reactive stage, your inactive stage, and your interactive stage. Please know what each of these are with regards to being given a scenario, right? You're the community nurse and you're developing a program with regards to infectious disease prevention. And here's the scenario. Which stage is this at? Is it in a reactive? Is it reactive? Let's say the scenario has the nurse projecting out future needs. Well, that's the pre-active stage. Okay. Let's say you're trying to determine the problem using past identified needs. That's the reactive stage. Epidemiology can be hard in the community setting because we typically think of epidemiology in the closed settings, right, in the hospitals and stuff, but epidemiology plays a huge impact in the community settings. The other thing with regards to infectious disease and prevention and control is vaccines. And we know that vaccines, it's proven, it's fact. Vaccines are one of the most effective methods of preventing and controlling communicable diseases. We all know about all the childhood vaccinations, right? That are given in the first couple of years. Okay. What do we do? I just read a story recently from, I still belong to NASN, National Association of School Nurses, even though I've retired, but I still belong there. I just read an article in the last week that the exemption rate for vaccinations in the school age kids has never been higher than this year. For whatever reason, they gave numerous reasons. So let's say you are working in a well child clinic, okay, and you are the nurse and the kids are due for vaccines and the parent says, no, I don't want vaccines. I'm going to do a personal exemption just because I don't want the kids to have vaccines. Our doctor's going to do a medical exemption because so-and-so has this condition that is counterproductive to get the vaccines. Or our religion doesn't support the kids getting the vaccines. Okay, so you can refuse to get vaccines, but there has to be some kind of disclosure. The 3 are the personal, the medical, and the religious. Okay? So really, the only thing that you can do, I mean, you can't be judgmental, you can't be critical. It's up to the parents to make their own decisions. What you really can do is educate. Educate on the importance of vaccines. That's about it. And vaccine compliance is becoming more of an issue over the last 18 months. I talked to one of my old teammates in my school job, had lunch with her a couple of weeks ago, and she was saying that the vaccine non-compliance rate is through the roof this year, as of September when we started school. Higher than she's ever seen it. And we were both in the district over 20 years. Okay. So that's what I want you to know about vaccines. Then we get into HIV, hepatitis, TB. Okay, we know that STDs are a major public health concern in our country, right? We have STDs that are either bacterial or viral. We know that bacterial can be treated with antibiotics, and viral obviously cannot. Right? Viral turns out to be a lifetime management of symptoms. Right? The most common bacterial infections, gonorrhea, syphilis, chlamydia, cured by antibiotics. Okay. I want to mention something specific about syphilis. It is a bacterial and needs to be treated. If syphilis isn't identified early in a pregnancy, syphilis can actually be transmitted or transferred to the fetus transplacentally. And that presents major, major risks to the fetus. Stillbirth, premature babies, developmental delays, disability. Okay. So then these notes go through and talk about each of them. Chlamydia, you need to know whether it's bacterial or viral. How is it treated? Okay. Herpes, viral and incurable. So I want you to read about that. Okay, what I really want you to know is viral, bacterial, how is it treated? And is there any special teaching instructions that we need to provide our clients with regards to these? And this is all in your notes. Then with hepatitis, you have hepatitis A, B, and C. Know the differences between those. And there are HIV and our TB. Okay, so those are the particular, those are the specific conditions I want you to know about. Okay, there's several questions about these on the exam. Okay, so know what each one of them are. And then jumping into bioterrorism and disaster management. We know that there are two kinds of disasters. There are natural and man-made. What's a natural? Give me some examples of natural disasters.
Earth, like tornadoes and hurricanes and stuff.
Earthquakes, communicable disease epidemics, droughts, hurricanes, naturally occurring. The other disaster is man-made. What we create. Pollution, warfare, fires, water supply contamination. Those are all examples of man-made. Okay, we as nurses in the community are expected to participate in any stage of a disaster, whether it's the preparedness, whether it's actually during the disaster, post-disaster, and recovery. We as nurses we have to be prepared to work in any of those stages of a disaster. Okay. I have highlighted in here when teaching a family, let's say we're working in the preparedness. How do we teach a family to prepare for a disaster? What do we tell them has to be in their little disaster kit?
They need water, flashlight, things, medication if taken.
Absolutely.
Perishable food.
So here's your list. Stock enough food for 3 days. Review the kit every 6 months. Ensure all members know where the kit is located. And make sure everybody knows how to turn off utilities. Then we want to review the supply every 6 months to make sure there's nothing expired. We've all been involved in disaster drills, fire drills, right? But there's also a bigger drill that is performed in a lot of communities. It's called a mass casualty drill or mass casualty exercise. Right? Those are conducted with all the agencies that would be notified with an actual mass disaster. Okay, those mass casualty exercises look at how'd they do? How was our response? How well did everybody work together? Did everybody perform what they were supposed to be doing? Okay, the earlier we can respond to these mass casualty events, hopefully the risk of fatalities or illnesses or injuries is reduced. Okay. With regards to bioterrorism, there's a couple of agents I want you to know about: anthrax, smallpox, and sarin. What's the difference between smallpox and chickenpox?
So it says here smallpox can be found in the palms and the hands and the soles of the feet.
That's the difference. That does not happen with chickenpox. Okay, you're going to you're going to have questions on the next exam with regards to these agents. So please understand, what do they present with? What are the signs and symptoms? What do they present with? How is it treated? How do we protect ourselves when we care for clients with any of these kind of exposures? Another issue with bioterrorism and disaster is foodborne illnesses, food safety. You know, we hear these stories when there's a hurricane or a flood with regards to contaminated water, contaminated food, right? Always an issue, right? And then we have our vector-borne illnesses, our Lyme disease, our Zika virus, malaria. Those are all the insect-created illnesses. So there's a lot to think about with regards to infection control, communicable diseases, disaster preparedness. Lots can happen in the community. Lots. Has anybody ever been involved in a disaster drills with your employers? Fire drills in the schools, fire drills with your employers? They seem to be the standard operating procedure at this time. I know in the schools, every month, fire drills, disaster drills, evacuation drills. Okay. So that's what we covered last week. That would have been the content from last week. This week is home care, community resources, case management, and your care of your complex chronic illnesses. Okay, so when we think of home care, it's in the community. It is believed that the home care, the home health visit, is one of the most important visits a nurse can make. Okay, this isn't in the hospital. This is in the client's own environment, where you can do lots of different assessments, right? We know that in the home, we're providing individual care, right? So we have the opportunity to do lots of different kinds of assessments. What could we look at? You're the home health nurse. You're going in to make sure that they have enough medication for the next couple of weeks. You're going in to make sure their wound looks okay. You're going in to make sure to give an IV antibiotic through a PICC line. You're going into make sure that all the other services are working, PT, OT, speech, they have enough equipment. What else can you assess in the home? You go in there for one or two reasons, but what else can you assess?
Risk factors for falls, their safety.
Absolutely. Safety assessment. What else?
Their mobility function.
What
Their
about
medications.
medications? What about their environmental assessment? What are they at risk for environmentally within their home? Are there chemicals around? Are there kids around that can get into chemicals? So you do a whole environmental health assessment. You can do a risk assessment. If they're living with family members, or they're living with caretakers, are there any signs of abuse or neglect?
Hey, turn it down, boo. Excuse me, is checking for mold considered, that's an environmental, right?
Yeah.
Like around the house.
Safety
Mhm.
assessment, environmental risk assessment,
Oh,
or environmental assessment, risk assessment for neglect or abuse. You can do an assessment of the family dynamics. Right, so there's lots of things you can do in a home care visit. Okay. Traditionally, home care was set up for homebound patients. That's what it traditionally was. Now, think about all the care that is done in the home in the community setting. Right? Think of just 10 years ago what home health was versus now. Okay? We can train, we can empower clients to take care of themselves at home. We can train family members to help care for clients at home. Right? We can motivate people to be empowered to be responsible for their own care in their home settings. Most clients want to be in their home settings, and they're motivated to try and take care of themselves the best they can. Nursing assessment in the home may take a whole lot longer for the home health nurse as opposed to you doing an assessment of your patient in the hospital. Why is that? What's the difference of doing your assessment in the hospital versus doing it at home? What's the most important factor? You're in their home.
They have to trust you.
They have to trust you. Exactly. You have to build rapport. You have to build a relationship. Right? The family needs to trust you. The client needs to trust you. And remember, home care is maybe a team effort, a collaborative effort. Let's say you're checking in on somebody who's had a stroke. Well, also they may be receiving PT in the home, OT in the home, maybe speech in the home, maybe a home aide to do cooking. All right, so home care most of the time is very collaborative. Okay, so that's important to remember. As far as community resources, we as community nurses, public health nurses, need to be very knowledgeable in the resources available in our communities. Each client we visit that needs resources is probably going to need a different kind of resource. Remember, in the community, we take care of clients across the whole lifespan. So a new mother with a new baby might need different resources, will need different resources than visiting a client with mental health issues and substance abuse issues. Okay, versus an elderly client that needs transportation resources to get to the local community center. Everybody needs different resources. Okay, those resources are meant to be helping clients manage their chronic illnesses, to try and help reduce their vulnerability and risk, to help them move towards independence, You know, you have examples like Meals on Wheels, Red Cross, food banks, clothing banks, maybe crisis pregnancy centers, homeless shelters, domestic abuse homes, shelters, churches, transportation services, maybe sitter services. So we have to be very knowledgeable about the resources that are available to our community. Every community looks different. The other thing we need to do is be able to reach out to key stakeholders in our community for help as a community nurse. Let's say your community has a high crime rate. Maybe you reach out to law enforcement, partner with law enforcement to come up with some goals and objectives for how to try and reduce the crime rate. Let's say you live in a community that has a high suicide rate. Maybe you partner with the mental health services in facilities in your community to do outreach to this group. Maybe you live in a community with a lot of homeless people. Maybe you're reaching out to homeless shelters, mental health support for this population. Does that make sense? There's a lot of vulnerable populations in every community, and they can all use resources, right? One of these bullets here talks about the non-English speaking. What do you do if you live in a community that has a large non-English speaking immigrant population? You can look at interpreter services. You can reach out to religious leaders of that culture to help you. Okay? So community nursing is like home care, very much a team collaborative approach. Okay? Case management. We know what case management is, right? What is a case manager? What do they do? We've talked about this before a couple of times in class. What's case management?
They're the ones who gather up like information that you may need and try to help people.
Mm-hmm. Yep. Case managers are the coordinators of care, right? Typically, very high risk clients are case managed. Your complex chronic patients with chronic diseases. Maybe your clients that have comorbidities, they have 2, 3, 4 things going on at the same time. For example, let's say you have clients with mental health issues and diagnosis and a comorbidity of alcohol abuse or drug abuse. Their case management is reserved for very involved cases where the nurse or the case manager is going to have to be that coordinator of care. Pardon me. Let's say you have a client going home that's had a stroke, that has mental health issues, that needs oxygen, lives alone. A case manager is going to have to coordinate all that care. I just recently had a family member back east come home from the hospital that needed tons of coordinated care. PT, OT, medical equipment, help with their insurance, help with getting a will done, power of attorney, all that. Case managers coordinate all this. They work with most of the time they work with clients that are getting ready to go home, right? They're coordinating, how do we make the transition from the hospital to the rehab center or the hospital to home, right? Or the assisted living to the hospital. There's a lot that has to happen. There's a lot that has to happen when clients are moving from one place to the other. Okay? And then the last part here is care of the chronic complex illnesses, which you had a few quiz questions about. These are the clients you're going to have questions on all of these. You need to go back to MedSurg, to your MedSurg refresher. What's cirrhosis? What's COPD? Type 1 diabetes, type 2 diabetes, peripheral artery disease, chronic venous insufficiency, hypertension, post-op care. Okay, there's a section on each of these. Okay, starting here with cirrhosis. It goes through it explains the disease, which should be a refresher. What are the interventions? Okay, so it goes through all of those, but I did want to go through the top section of this, which is post-op care. Post-op care, we're always thinking about ABCs, right? Airway, breathing, circulation. We're thinking about safety. We're thinking about pain control. And we're thinking about potential complications. So what do we need to assess in our post-op patient? We need to assess circulation, which could include, that was one of your quiz questions, potential risk for a DVT, sepsis, dehydration, potential urinary tract infections. If they have a wound, how is that healing? Do they have any pressure ulcers? Is their pain managed? If their pain's managed, do they have any side effects from the pain medication, such as nausea, vomiting, constipation? We need to be assessing lung sounds, right? Pneumonia, pulmonary emboli, respiratory depression. How do we prevent complications? Well, we know that aseptic technique with changing dressings, handling any kind of secretions, turning, coughing, deep breathing, using incentive spirometry, encouraging fluids, pain control, and so on. All of these will help prevent complications. So I do want you to read through this section here, preventing complications. And some of the teaching we can do with our clients in helping to prevent complications. The other thing I want to review is LPN delegation. What kinds of clients can you not delegate to your unlicensed assisted personnel? Who can you not delegate?
Unlicensed.
A client who's like unstable condition.
An unstable condition,
What
right?
about mental?
Pardon me? The most important is an unstable patient, right? We need to be careful when we delegate, though, because they're working under our license. So some of the things during the post-op period that you need to be instructing the people you're delegating to, what has to be done? How is it done? What needs to be reported to you for any red flags? What needs to be documented? Because ultimately, if you're not reviewing this with the people you're delegating to, you're responsible. Okay? It happened to me several times in the schools because we were a consult to the schools. We weren't site-based. We had clinical, we call them, what do we call them? Health aides. We had health aides in all the clinics that we worked with and we delegated and we trained, and they had to train and become proficient in caring for the kids coming in the clinic, whether it was medication administration, whether it was diabetic care, seizure management, Obviously, we didn't delegate, the trach care and the suctioning and the cathing. We did that. But there were several times over my 22 years that I had to pull delegation. Because no matter how much training I did, the person in the health clinic was incompetent to perform their duties. Whether they didn't understand the training or they didn't pass the competency tests. But they were all operating under my license. So delegation is important. LPNs, LVNs delegate a lot to unlicensed personnel, do you not? A lot. So you've got to make sure you got to make sure that you teach and mentor them what you want done. Okay? So that's delegation. And the rest of these notes are the complex chronic illnesses that you can read through. Okay? So any questions? We covered a lot. Covered 2 weeks worth of material. You've got your notes from week 7 and week 8. This weekend, you'll get your notes for week 9. We'll have class next week, and then that's it for content. Week 7, 8, and 9 is covered under exam 3. And once we do our content next Tuesday, that's it. No more content after that. So week 10 is your exam, and week 11 is your HESI. So take the time to start working on your study guide. Review your notes, review your lecture notes. Definitely review your readings. Okay. If you already have not done your readings for week 7 and 8, I highly encourage you to do that. And then, of course, you have your notes to go from. And if you missed any of the lecture or want to listen to any other parts of the lecture, I'll send out the recording and you can listen to that. Okay. Does anybody have any questions? So as you can see, there's a lot that goes on in community nursing, public health nursing that you probably weren't aware of, right? Your community just kind of goes with the flow and everything functions. But there's a lot going into the health of your community and the health care that has to be provided in your community with these community nurses and public health nurses. Comments, questions? Where's Rashima? Did you respond? Oh, you did. Hang on. Let me see if I have to respond to anything in the chat. Oh, you guys are answering my questions in the chat. So Rashima, that is okay then. Tomorrow at 2. Yes? Where are you?
Yes, that's fine.
Okay, I'll put you in. I'm gonna, if anybody wants to schedule any reviews, I'm really trying to wrap it up tomorrow afternoon, mid-afternoon. I'm gonna take some time off, as I hope you guys will too. We are actually on holiday Thursday and Friday, so I plan to take those days off. I'll check my emails and stuff sporadically, but I am going to take some time off. Okay, so if you need to reach out to me today, tomorrow. Okay.
Are you going to send out the week 9 blueprint a little bit earlier?
I could. Would that be helpful?
Yes, please.
Yeah, I could do that. I could definitely do that. In fact, maybe I'll do it today or tomorrow. And it will give you guys an opportunity to work ahead. Yeah, great. Great. I'll be happy to do that, Mariana. Happy to do that.
Thank you.
You're welcome. I hope everybody has a really good Thanksgiving. Anybody cooking anything? I don't cook anymore. I'm sick of cooking. I'm 62 years old. I've already cooked enough Thanksgiving dinners for my brood, which is 8. So no, I'm going. That's when you get to be my age, you get to let your kids do it for you. So no, I'm not cooking a turkey. I'm going to kids' houses. I'm gonna look at Christmas decorations at kids' houses. I'm not doing any of that anymore. So anybody cooking? Who's cooking turkeys? Not me. Who's cooking?
Yeah, not me this week, this year.
You're going someplace else.
My husband is frying a turkey, but we're going to my
Oh, delicious. My son does that. My son does that. It's delicious.
Oh yeah.
Anybody cooking any special side dishes other than the typical turkey dinner stuff? Well, I hope everybody has a wonderful Thanksgiving and try and take some time off for yourselves. Okay, I
Thank
know you
you,
don't have
you too.
much. I know you don't have much, but try and take a little bit of time for yourselves. Okay?
All right.
Thank you. Happy Thanksgiving.
All
Happy
right. Thank you.
Thanksgiving,
We'll see you
Vanessa.
guys
Thank
next
you.
week. You're
All right,
welcome.
All right,
bye.
next week. Bye.
Bye. Bye-bye.